Welcome to Uncommon Minds, where we sit down with truly amazing innovators and unique practitioners across common fields who think outside the box and carve their own paths to success. I'm your host, Shelly Henriquez-Neal. Let's lean into another great episode right now. So what does it take to build a work culture that keeps people energized in one of the most demanding sectors? Public health is that sector. And you have to make sure that if you're going to keep people energized, you have to let them know that they're going to be supported and have them feel supported and feel valued and feel motivated. And that's no small feat. It just really isn't. And I think you know all of the reasons why. But what I'm really excited about for this episode is that I'm joined today by Dr. Tonii Gedin, who is the Arundel County Department of Health Officer. Is the person in charge of the Arundel County Department of Health. And she has become known not just for the public health outcomes that that department puts out, but for building a truly strong people-centered work culture and being about sustaining a very strong people-centered work culture. With a county of approximately 600,000 residents, the department is ready to support all of them and really has to be, and has done that for this county since 1930, I believe, Dr. Gedin. So, Dr. Gedin, you haven't been there since 1930, obviously, but it might feel like that sometimes. You have been in this role for the past about 5.5 years, I think, and your reputation is really, really strong. When I take a look at or hear some of the anecdotal feedback from members of your staff and team that work alongside you, it's often very, very positive. It talks about how committed you are and how dedicated you are. You're truly a grassroots and hands-on person, but as a leader that shows up, and it helps to motivate your team members as well. I really want to thank you for being here because you are an uncommon mind. Thanks for being here, Dr. Gedin.
Thank you for having me, Shelly.
Yeah, I really want to start the same way I start with every guest, which is to talk about your origin story. And then we can kind of ease into a little bit of your role. But really the question is how did you come to a role in public health? Was this something that you've always wanted to do, or did you have early aspirations or inspirations? So talk to me a little bit about that. How did you get to this point?
It's been an interesting journey, and I can't say that I plotted it out this way, but my early inspiration, I would definitely cite my mother for that. So as a nurse, my mom's a nurse, and I was always really fascinated by what she did. Strangely enough, fascinated by how she smelled when she came back from the hospital. Her scrubs had a very specific odor that I remember very distinctly. And so I think really early on, I decided I wanted to be in healthcare. In high school, middle school, elementary school, kind of bounced between a nurse, maybe a surgeon, maybe even a dentist. Like I graduated high school thinking, I want to be a dentist. Decided against that in college, majored in nursing. I went to North Carolina A&T State University, Aggie Pride for any of your listeners. That's really when I was introduced to public health for the first time. It was a study abroad excursion between junior and senior year. Public health is not something that's heavily emphasized in nursing school because they're teaching you to really do hands-on patient care safely, right? And there's a public health course that you take working in a bachelor's in nursing, but everybody is, myself included, very, okay, I want to be this type of nurse and this type of advanced practice nurse. So I thought I would go into the ICU after I graduated, wanted to be a nurse anesthetist, and I went to South Africa for 10 weeks to do this random thing that a teacher was like, I think you'd be great for this. It's a partnership between Johns Hopkins and HBCUs to get students involved in research. And I was in South Africa doing work around why women who had experienced sexual assault were not taking post-exposure prophylactic medications to prevent HIV. And so all the stigma, all the access to care things, I thought this is really fascinating. And I met some incredible public health nurses And I kind of put it on the back burner, right? It's like, I have a plan. It's senior year. This is the plan. It went as planned. I went into the ICU. I liked it a lot. I applied for CRNA school, which is the nurse anesthetist, and I got
Mm-hmm.
waitlisted. And I thought, I want to do this. I really like public health. And I actually remember talking about public health in my interview for that
Yeah.
program because they had this like, oh, you can do it, other things that you're interested in. I'm like, I really like public health. I'd love to do something in that. And nothing could be, the jobs could not be more different. And I applied to the University of Maryland. I'd actually already done it. I'd applied and gotten into their program for community and public health nursing, a master's degree. And as
Yeah.
I was waiting on anesthesia school, I had told them, I'm going to just put this, going to defer my enrollment, see what happens with anesthesia school. And then I'm going to move to Baltimore because I'm from North Carolina originally. I was living there and
Mm-hmm.
pursue this degree. And I remember my mother saying to me, like, what are you going to do with a public health degree? Give shots at the health department? Little did she know, and myself included, because again, even my mom as a tenured ICU nurse and
Oh.
a master's degree in critical care and a PhD in education because she was teaching nursing at the
Mm-hmm.
time, didn't really know the extent of which public health could take you and where you could
Yeah.
go and what all the different things you could do could be.
Yeah.
And so I went from that to then working in federally qualified health centers in Baltimore City, which I really, really love, that direct patient care and leadership roles in those areas. And then I came to the health department in 2020. And it's been, I haven't been here since 1930, but it's definitely been dog years since 2020, joining the health department. But that's kind of my inspiration for this when I got introduced to public health. And I think for me, it was always about health disparities, right? It seemed
Right.
so wild to me that people could have such different health outcomes despite all of the healthcare advances we have in this country, like that people are dying prematurely of things that are preventable or
Right.
things that we could improve their health, that people didn't understand their health. And working in the ICU, I saw one end of that spectrum and a lot of people who didn't understand why they were as sick as they were, what had happened to their family member. And I wondered, like, what's happening on the other side of that spectrum? Right? And I think public health and primary care is the other side of that. And I've really enjoyed it quite a bit.
Thank you. This story is amazing just to hear from everything from, oh, it's what my mother smelled like. And the journey up until now is amazing. We had a guest on actually one of our earlier podcast episodes, and she talked about that sense of smell being one of the first, if not the first sense that you recall, the earliest memories. You remember the smell of things. And I'd never heard that before. And it's so interesting that you bring it up here. What do you think it is for you about that ability to connect with people directly in person and get to the root of it? It's not like you're hearing about it through 3 or 4 different layers in a hospital or what have you. You're literally connecting with the person who has the ailment or has the question. What is it that you feel when you're experiencing those connections with people?
I wish I could do more of it. It's absolutely wonderful. It's a privilege as a healthcare provider, as a nurse, when people let you in to their
Hmm.
most vulnerable spaces, when they're sharing with you things that maybe their families don't know about them, right? There's a level of trust that people put into nurses, other healthcare professionals of like, okay, you're here to do good, you're here to
Sure.
help, and I'm going to trust you with my story, with my situation. And there's something about knowing that you're going to work to try to make a difference every day and
Yeah.
actually being able to see that difference. So I think patient care and connecting with people in any format that I've ever done it reminds me of why I'm doing it, but also that proximity to understanding what the problem is, right?
Yes.
What is it that's actually a barrier for you? Or what is it that you want out of your healthcare? What are you looking for? And how can I help you get there as opposed to me telling you this is what you need to do? Of course, I have health recommendations. We give them out all the time. But what you think will work and what actually works or what people need or want may not always align. And that
Mhm.
proximity to people is where you actually find out how it's going to work, if it's working, what they're happy with, what they don't like.
Yeah.
And I think that is so important, even when you get in roles like mine, where you could avoid talking to people
Sure.
Public anyway, if you wanted to. I personally find it really rewarding to know what's going on. And I think that proximity to people also aligns itself to leadership. The concept is very much the same, right? Like I
Yes.
should not be designing healthcare systems and programs for folks that I'm not interacting with. Should also not be designing a workplace for people that I'm not interacting with, right? Because I sit in a
Exactly.
very specific place. I have a very specific perspective. Same thing with healthcare. What I know about it and how I receive it and view it is different from you. And so understanding where people are, what we can do is important. It really makes a difference to be in proximity to people and it helps us do our jobs better. Right. It's
Yes.
not just about delivering the service to you, but it's, well, how can I be better? How can we be a better health department by learning this from you and treating
Absolutely.
people's lived experiences as expertise? Because that's exactly what it is.
Absolutely. Absolutely. And I love that you're speaking about this in such a way that it's a very holistic approach, right? Your approach to working with patients, which evolved into your approach to working as a leader and leading teams who do that primarily, is really a combination of practitioner, educator, researcher, and pulling it all together for the greater good. So it's really fascinating to hear that all come together. And it can happen in one moment, in one conversation with one patient. So take that and make it exponential or broaden it to an entire community, and there you have the real impact. At what point, though, in your role as a leader, did workplace culture become something that you felt personally responsible for?
Oh, personally responsible for. That's a great question. Probably, I was the director of nursing at Healthcare for the Homeless in Baltimore.
Hmm.
And I supervised some staff before that, but the culture was not my responsibility, right? I
Hmm.
was functioning within it and trying to create a culture for a real, small team, different
Hmm.
folks that worked for me, but I wasn't really in much of a position to change it. And then when I had a larger team of nurses and medical assistants who were interacting with patients, who were working with physicians and nurse practitioners and case managers and dentists, really understanding how people were working together. What are the things that were causing friction between those individual teams or things that they were doing? And how could we help them better understand each other as
Yeah.
well as the needs of the patients? And so I think getting to a place and working through patient centered medical homes
Hmm.
specifically and what that means in FQHCs was really probably where I started working on culture and understanding that we needed to put the patient in the center of the decisions we were
Hmm.
making.
Hmm.
That didn't necessarily mean sacrificing everything that the team wanted, but you did have to ask yourself, okay, if we're telling somebody to come back for their labs tomorrow, what does that mean for that person, right? I get
Right.
that, like, maybe and what can we change to make it possible to do it today? Why is this a frustration for the medical providers, right? What is the frustration for the medical assistants that are drawing the labs? And how do we work through that? So I think that's probably the first job I had where I thought, okay, I can actually change the culture here. And it morphed into creating team based care, right? Because it's like, okay, we need providers to come together around these patients. The patients already assume that you're talking to one another because you're in the same building and you work for the same place. They
Sure.
understand that you're not. You should be. But how do we create spaces where that's prioritized, where we're talking about it, and systems that make it functional and make it easy for you to do it and not a huge task? Like, I need to go hunt down Shelly over there and tell her a thing, right? How can we make this communication easier? How can we set up systems for you
Yes.
so that it runs differently and the patients feel that impact and you feel it because you know it's
Yes.
moving. I've talked to my colleague. We're getting somewhere. And so I think that first foray into team-based care specifically and setting up those really large multidisciplinary teams was
Yes.
an eye-opener.
I love that. I love that. Thank you for sharing that. What does a great work culture look like in the department? And it could be some of what you just said too, right? I don't have to go very far. I don't have to say, oh, so and so didn't respond to me. So there's nothing I can really do about it. Oh, that's not for me to do. That's not really in my department. It's or in my bureau. It's in this bureau. You're responsible for, is it 6 bureaus technically?
Yeah. So 5 public health bureaus and then administration.
Yes. So that's a lot of different areas of focus It doesn't sound like a large number, but it is. But when you think about the broad span of their areas of focus, then you can kind of do some math there and understand how deep that can go. So being able to round out a cohesive or great work culture across those is not an easy task. It's not an easy task. So what does that mean, or what could that look like? And has it looked that way? I'm sure it has in your agency, in the department.
I think it looks like a few different things. As you mentioned, having kind of 6 different areas of focus and almost 900 staff members in those 6 different areas. The person who is the nurse in a school has a vastly different job than the person who's inspecting restaurants, right?
Yeah,
So when you think about those 2 different roles, but how do they experience the health department, regardless of those roles, is something that I've been kind of keyed in on. I think it's a culture of honesty, transparency, a culture of listening to people
yeah,
and trying your best not to be defensive about what you're hearing, because 2 things can be true. Right? You can be working
yes,
really, really hard to fix something and people can still not have the experience that you're hoping that they're having from it. Right? So
sure.
it doesn't mean that you're not trying, but this is still how it feels to be them and understanding their perspectives from their work. I read a quote the other day from our employee satisfaction that I thought, this is incredible. The person likened it to, like, he said, learning this job was like learning to swim with your crazy uncle. It drops you in the deep end of the pool. You're swimming and then you're trying to do what somebody else is doing, but your crazy uncle's just yelling things at you. So it's not, you don't follow what that person's doing, but they're still not telling you how to do it. And I thought, I wonder who wrote this. And I really appreciate their honesty, right?
Yes,
But it goes back to the learning and development work that we're doing,
yeah,
because people don't feel like they're adequately equipped to start the role. So when you
yeah,
start to listen to what people's concerns are, how can you address some of them? Having a culture where it's, you said this, we're trying that, right? We may not get it right. We're
mhm,
trying though, and we're telling you that we're trying, and we're telling you that we heard you, right? We heard what you said. We're paying attention. We read the comments. We're listening to your engagement, and we want you to tell us how you think it could be better,
mhm,
right? You might have the idea that we need. And how do we make ourselves open to hearing that? And I think some of that really starts with the work that you have to do with your leadership team of, when are you out talking to your staff, right? When are you in the field seeing how things are going? How are you
yes,
connecting with people? That same proximity, right? Because you can get further and further away from the work and the people.
yes,
How do you know how it works and what they're doing with the folks who are, in WIC? How's the dental staff doing?
yes,
How are you hearing from them? What are the opportunities that they have to give you their feedback? And so
yes,
trying to create more spaces for that within the department, I think helps a lot. But also there's been a lot of uncertainty in public health over the last, it's been a while, but definitely over the last year with a lot of federal changes. And so
sure.
explaining to people, I don't necessarily know what's coming, right? But saying when I don't know something.
It's that vulnerability, right? And it's okay to say you don't know, because there might be some speculation if you're always saying you do know, or if you always do have an answer to something, right? And I think what I'm hearing from you is there's this sort of bridge of compassion. It's this operational compassion that's happening, where you don't have to go deep into someone's personal life and da 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 da, but showing that you actually do care as a leader, care about your team's experience or your team members' experiences and their input and their insights is truly important. Would you say that that is a leadership practice that you think has had the biggest impact on your team as a public health advocate, as a leader in the public health space?
I think it's probably a tie between listening to people and communicating,
Mm,
right? Communicating what I know, what changes are, how frequently we're communicating, the types of things that we're communicating, what's coming from me directly, right? How are we connecting
yeah.
with people and communicating, but making sure that that communication is bidirectional, right? That they're
Yeah.
able to communicate back. And that's hard for folks, right? It's
Yeah.
it's not easy for people to tell me what they're thinking sometimes. And I recognize that not everyone's going to tell me to my face that, like, you don't pay me enough. But some will. And I appreciate those
All right.
who give me that honest feedback, right? But making space for that and then responding appropriately when people say something that folks think maybe should upset you. That, like, this isn't, unless they're attacking me personally, it's not personal, right? This is
Yeah.
their job. They're telling me how their job is impacting them, and I can't take that on as a personal attack.
Yeah.
It's just,
Yeah.
okay, I hear you, right? What else
Yeah.
can we do about that? And I hear it, and responding in a way that makes people feel like, oh, it really is okay to ask her the challenging thing,
Hmm.
or to tell her, I don't feel like I make enough money, and she didn't say, yes, you do, or what do you want me, like,
Yeah.
but explaining, because it is, working in government is challenging, because a lot of things, unlike other like CEOs or presidents of organizations, there are a lot of things that
Hmm.
are outside of my control, because we're
Hmm.
working within both a county and a state system. So even just explaining how the systems work to people, I think, is
Yeah.
half the battle, right? So that's the communication that we do of, this is how our budget is created. This is what
Yes.
it looks like. This is how certain policies come to be, and this is what I can control here at a
Hmm.
department level. And here's the thing that, the state is controlling. So
Hmm.
explaining that to people, I think, even if they're not happy, they can understand. And that goes a long way as well. And listening to what they're concerned about, and then saying, okay, here's what I can do, here's what I can't do, and making those spaces. We're always looking for new ways to hear from folks.
Absolutely. I love that. Thank you for sharing that. Couple of things I want to flag. I don't know if folks really made this connection when I introduced you and I talked about how long you'd been in your current role. That was the pandemic and the height of it, the beginning of it, really. I was reminded by our producer this morning, no, it was that year because I'm always thinking it's 2019. And I guess one could argue one way or another. And she said, no, and I'm pretty sure it was that year. And then we talked, I said, oh my God, she was right at the beginning of it. So having to get through that and get to now, tons of uncertainty, not least of which was to operate a public health resource for a county of roughly 600,000 people during a time of major, major health crisis, but also a team who has to rise to the occasion, who has to step up, who have needs, who are also people who are at risk. How do you communicate your expectations for excellence and being there and always being centered and focused without creating overwhelm or burnout? You talked about the uncertain times, as we're dealing with all of the political landscape changing and change of administration, but then there's this massive public health crisis too. So you've dealt with these very huge things, and I just hats off to you first of all. You're still standing and smiling and looking together and put together. And how do you do it without making sure that your teams don't burn out or don't achieve overwhelm?
So when I first started at the health department, you were correct. We were about 2 months into the pandemic here in the United States. So if it was March, I started in May. And I started as a deputy health officer. And I do have to give credit to Dr. Nilesh Kalyana who was the previous health officer, for just being a fantastic leader throughout the pandemic. He did incredible work, showed a tremendous amount of bravery, faced a lot of adversity and challenges. And I think the teams also kind of coalesce around that, right?
Hmm.
Watching a leader who's willing to do the thing that they think is right
Yeah.
and communicate that
Yeah.
regardless of what might be coming as a result of that.
Yeah.
There were lawsuits, and like it got pretty ugly at times. But I think the team seeing leadership work that hard, we weren't concerned about burnout at the time, because we
Mhm.
were burned out, right? There's no way to work
Yeah.
through something like that, work that number of hours, respond 24 hours a day, 7 days a week without the burnout being there, right? But acknowledging it amongst ourselves of like, yeah, we're tired. There's a lot of dark humor in healthcare. Public health is no different. There's a lot of jokes and things that people share, but they're also super dedicated people who are here to serve the public within the department. And I don't know that I have the right balance for how to make sure that the team is not burned out. I've shared previously with the team, somebody asked me, what keeps you up at night? And it's both, are we doing enough and are we doing too much? Right?
Mm.
Are we doing enough? Because there's always so much need within the community. There's something else,
Mhm.
another program, something else we could be doing to better serve the residents of Anne Arundel County. The flip side of that is, what does that mean for the staff? Right?
Mhm.
What is their capacity to do the thing that the community needs right now? Do we have the right resources? And public health has been historically underfunded, and the infrastructure is rocky at best at times. So I think telling people, when you're off, be off, right? Take
Yeah.
that break, step away, demonstrating that, people are like, you didn't send any emails when you're out. Nope. I'm out, right? I'm
Yes.
off. I'm trying not to check those. Encouraging people to take that time away, because when they're here and the pressure is on, the one thing about working in government is we actually don't have a choice about whether or not we respond, right? When the
Mhm.
crisis arises, it is our job. We are emergency essential employees. And I can't say, oh, take a break. No, we got to do it. So when we have those opportunities to take those breaks, making sure people are doing it, encouraging it, but also acknowledging burnout. What are the signs and symptoms of burnout? What does it look like for people? Trying to create spaces where people can share, where we talk about all the things that people are facing. We talk about uncertainty. We talk about what it means to be resilient. What does it mean to grow your resiliency as an organization? I consider myself really fortunate to work with so many great behavioral health professionals who help me to think about how to craft those messages and like what else should we be doing to make sure our staff are taking care of themselves as best they can. Some of it is just talking to people about it's okay to not be okay. What does
Yeah.
it look like if you're not okay? How do you express that at work, knowing that we still have a job to do, but what are we doing about that? So I don't know that I have the right answer for it. I think if you were to talk to my team, there's a balance between people who really love what they do, and I count myself as one of those, and you also relatively ambitious and like, okay, how do we pull back? But asking your team too, like, hey, am I doing too much? Can we
Yeah.
actually do this? Ready for
Yes.
this?
Yeah.
And it not just being, I want to do this, so we're going to do it this way right now, right? Giving
Mhm.
people the space to say, I think we need 3 more months. I think we need 6. I don't know if we have the capacity for this right now. When those opportunities for choice arises, we don't always have a choice in public health, but when we
Right.
do, having those conversations and doing that pulse check with the team to see how they feel about taking on this new thing and hoping that at least one of us in the room is more level headed. And maybe, and you know what? Maybe not right now. Maybe we don't do all of that right now. But anyway, that's, I think, some of what we're doing to try to take care of staff,
Yeah.
and being transparent with what I do myself, right? I'm
Yes.
not preaching that you should care for your behavioral health. And then I share with folks, like, I have a therapist. I check in with her to see how I'm doing. These are not things that I'm telling you to do that I don't actually believe in.
Right. Right.
Here are the resources for it. I'm trying my best when I get off to really check out and be present where I'm at with my family,
Mhm.
and then sharing with people a bit about me so I'm a little bit more human to folks and not just a figurehead.
Yes, yes, yes. You're truly modeling the way. And I love the practice of vulnerability, but also, as you talked earlier about the tie between where we talking about leadership practices that have worked, and you talked about communication being in there as a tie. That communication doesn't stop when things get chaotic. The opportunities to ask
No.
questions and to say, how are you feeling? Do you think this is working? Whether or not you can stop it or not is another matter. But giving people the platform, the space, and giving them the okay. It's okay to tell me if you don't agree with this. It's okay to tell me if you don't like this new policy or this new practice or this new system, whatever the case may be, is very important. So it's really good to hear that you're able to make space for that in an industry and in a space where there just isn't a whole lot of time all the time. There's not a whole lot of time.
There's not, and not everything we can, even if you don't like it, I can't always change it again, that state and county system sort of thing. But being able to have that, at least with the team that I work with directly, and then figuring out how to expand that, right? Because there's 900 people. I can't ask each person
Yeah.
individually, what do you think about this, right? But what
Yeah.
are the ways that we can do that? How do we work through various levels of leadership? So our
Yeah.
directors, our program managers, trying to make sure that we're having those conversations at various levels, because everybody's experience is different. And I personally think middle management is the hardest. I think our program managers, who are between the directors and the staff, have some of the hardest jobs in the organization,
Sure.
to manage people's thoughts and feelings directly and hear from leadership, here's what's coming. How much control do they have over what's coming? Right.
Sure.
Definitely give them input and space for that. But I think acknowledging that they're in an interesting space and a tough
Mhm.
space, and that those of us who have more control, like myself or some of the directors, right? Just acknowledging that there's a difference there in the power dynamic. Acknowledging
Yeah.
power dynamics at work, I
Yeah.
think, is important for me. Not to, I'm just one of you guys, like kind of, but not really.
Exactly.
I
Exactly.
wield some power over how your day works. So
Yes.
acknowledging
Yes.
that for people.
Yeah, yeah. What changes have you seen since this sort of the intentional focus on culture that you bring? When you look at where things were when you started, and of course your predecessor did such a good job of sustaining the culture that was present and we don't always start from scratch, but you were able to take that baton and move it into a different place. Obviously, this culture, it has to be different because every leader brings a different culture with them. What kinds of changes would you say you've seen between 2020, mid 2020 to now in your workplace culture?
Oh, that's interesting. I think I've definitely seen more acknowledgement internally about the differences that we bring to work as people, right? As a
Yeah.
health department, we've always talked about the different demographics in the community, what sort of things the community needs, the breakdown of people, education level, income, race, gender, sexual orientation. All of that is something that we've talked about externally. But acknowledging that people come internally as workers to the department with their own lived experiences. And what does
Mhm.
that mean, right? How are we welcoming to everyone who wants to work here and understanding that those voices, opinions all reflect the community. And we've got to figure out how to make sure people feel like this is the place for them, that they feel welcomed here, that they feel like they can come here and be the version of themselves they'd like to be. I don't always say bring your full self because there are
Yeah.
pieces of myself I definitely leave at home.
Yeah.
There are
Yeah.
pieces of Tonii that don't come to work. But how am I at a place where I can share as much as I comfortably want to at work,
Mhm.
right? And it's been great for people. I've heard from staff specifically who have said, I didn't really want to share in previous jobs my
Mhm.
sexual orientation and the fact that, I'm a woman with a wife and I have a child. And I'm just really glad that I'm comfortable doing that here, right? And that it feels okay to share that here. So hearing that from
Mhm.
people, because that is something you should be able to share at work
Absolutely.
without, you should be able to come and say, hey, look, there's a picture of my kids and my wife and my family and the dog and all the things, right? You should be
Yes.
able to live that experience like everybody else. And
Yes.
so hearing that from folks really means a lot to me. But then also, I cannot take my foot off the gas with, no, we're doing this. We're doing this. This is
Mhm.
important. This is why. And I have to stay committed to driving that home. I had a lot of folks ask me when we first started some of our work around culture. I hope this doesn't fade out, right? Like we've seen
Mhm.
it before. It comes and it goes, comes and it goes. And so trying to really hold myself accountable to, I said I was going to do this. I'm going to do it and we're going to keep moving. And it's gotten increasingly more difficult in the current climate, if I'm being
Mhm.
honest. But it's one of those things of like, all right, if this is what you believe in, you got to keep moving, right? If this is what you really think the workplace should look like, if this is what you think the community needs from this workplace,
Mhm.
how do we keep moving that forward? And so hearing from staff that they're happy with the direction of leadership, that they feel like the department's moving in the right direction, even if we haven't figured it all out yet, is really, really helpful. I
Yeah.
appreciate when folks give me that sort of feedback.
How has the culture impacted the community outcomes?
Oh, that is a really good question. And I
And it's ongoing too,
think
right? It's not just a one stop, like, oh, there's just one thing. It's always growing.
it is certainly always growing. And I think a lot of it is how are we building trust with the community? We're both a healthcare organization and a government entity. And
Mhm.
that can be hard for different populations to like, I'm going to trust, I'm going to go here. I think they'll help. I think it's going to be different. I think I'm going to be treated with dignity when I'm there. And so I think some of our efforts to work with community partners who are from those communities within the organization, we have health ambassadors who are community based organizations that are going out and sharing health messages, who are sharing resources that the health department offers. They don't work for the health department, but they're out speaking on our behalf, right? They're talking about what we offer. They're sharing health information with their communities. They are trusted. They trust us. And then people come because such and such said, I should come here. building that trust even with those organizations that we're going to do what we say, that we're going to follow through, that we are translating things into Spanish and Korean,
Mhm.
that we are going to come to your event, right? If you invite us out to your health fair, to your cultural festival that may be going on, that we're going to bring some tables and talk to folks. And we're going to try our best to get folks there that can speak the language. If we can't, we're going to try to bring the right technology or things with us to facilitate that communication. I think also we see a change when we're being intentional about how we communicate with the public, the messaging that we put out around various populations and the challenges that they're facing. So looking at our maternal and infant health task force, talking about the disparities we see in maternal outcomes for Black women and birthing people, right? That's important, right? We
Yeah.
have to name a thing. And I
Yeah.
think people trust you a bit more when you name the thing, work on the thing, and value their lived experience. So I think what we're seeing is more engagement from the community, but
Mhm.
it's required a lot of work from staff to
Mhm.
go into the community, right? To go to more health fairs, to go to
Yeah.
more events, to do that outreach work, to meet people where they are and say, okay, you weren't ever coming to 3 Harry S. Truman or one of our other buildings,
Sure.
but I'm going to meet you here. And then maybe you'll come over here, right? Maybe you'll reach out to us. Maybe you'll call this number. Maybe you'll think of your health department for something other than the things that maybe you already know us for, if you know what we
Yeah.
do at all, right? A lot of people, it's an introduction to the health department and what we can do to help them, or even just to be the conduit to some other help they need somewhere else, sharing
Yeah.
resources. So I think we're definitely seeing more engagement and trust from the community. And I hope it sustains. It's really hard right now. Trust in public health is,
Sure.
it's a challenge. So trying to
Sure.
make sure that we're connecting with our community in a real way
Yeah.
is important and that we're showing up.
Shifting now to just a sort of a personal insight, you as a leader and a public health practitioner, what do you wish someone had told you before you stepped into leadership in this space?
What would I have wanted to know before I stepped here? So I've done one of these personality tests before, and this was one that like made everybody a different animal, and I was an owl, and it
Yeah.
told me that I'm a person that likes a lot of information, right? And
Hmm.
so I asked a lot of questions
Yeah.
when I was considering this role. So I feel like logistically, I had a really strong grasp on like what it would be. I
Yeah.
think the thing that I had to learn for myself, and I'm not sure anybody could have told me, is what it means to be number one in an organization. You can be really close, you can be the number two. It's not the same. And I think someone describing what it means to hold that level of responsibility, there's nobody, yes, the state and the county exist, so I don't want to say no one. But for some stuff, the buck stops with you. And
Hmm.
what does that mean? Right. And what does that mean for you mentally? What does it mean for your sleep? What does
Yeah.
it mean? And how do you detach from that? And how do you find other people in that same position to be in community with? I think that's probably the one thing that like now you're in a role where there are no peers within your organization. There's
Yeah.
no other health officer here, right? I'm one of
Yeah.
one. And so how do you connect with other health officers in other counties, other department heads in the county? Like that those relationships are important for you because you can't vent everything to your staff, even the deputy health officers, right? Like I do have to
Yes.
have like I'm the leader here, right? And some of the things that I think or want to share or my frustrations everything can't go to them. We're a really close
Yes.
team. Sean and Tope are amazing. I really enjoy working with them, but developing those relationships with people who are in similar positions, so they're like, how you doing? Not good.
Yeah.
Like, it's just, and being able to
Yes.
have that level of candor with someone who's not in this organization, right? Who's listening, but understands that I
Right.
think is the thing that I wish someone would have told me. Like, develop those quickly. Find some people that you can talk
Hmm.
to that's not your significant other. I love him to
Yeah.
pieces. He's tired of hearing from me about some of this stuff, and he always listens so patiently. So, Corey, if you listen to this, thank you for listening. But he's also, he doesn't live this experience, right?
Right.
And so I think that's the other piece. You really need someone who understands what it means to be one of one in the organization and the pressures that come with that. So I think I wish someone would have told me, like, do that
Yeah.
quick. Like, don't
Yeah.
wait. And don't expect your team to fill that void for you, right? That's not fair to put that on your team.
Exactly. Yes,
Expect them to
yes,
be the end all be all, which they can't be.
yes,
It's not fair.
yes, absolutely. That's a really good one. That's a really, really good one. At the end of every episode, I always ask a signature question that really ties in you as an uncommon mind to your work and your experience. What is one uncommon insight about public health that you discovered through this role? Nothing could have taught you. There were no case studies where this came up, but through this role, you discovered this.
This is one that I knew, but I didn't fully understand,
Yeah.
which is exactly how much policy and elected officials shape governmental public health. Understanding legislation and that connection, what's written into legislation that then becomes, oh, we've got to go inspect this because someone wrote that into legislation. I understood it from a technical standpoint, but
Sure.
understanding how it actually works, how it comes to be, where are the opportunities for input, how to talk to people who I'd been very used to working with other healthcare professionals, right? Those were the people around me. In this space, you work with so many people who are not healthcare professionals, right? Most of your elected officials are not. So you're trying to both educate, persuade, help them get to whatever they're trying to do because they've got an idea and they're trying to solve a problem, but they're not necessarily content experts on that thing. What does it mean to work with a lot of people who are not in the healthcare space? Of course, I'd done that with patients, but working with a patient is very different than working with other people who are helping to mold your work. But
Right. It's a different type of buy-in.
That is one thing that I now have a much, much stronger understanding of what that means, how it works here in Maryland. It's different everywhere. How it works in Anne Arundel County. That's it.
Thank you so much for the work you do, for modeling the way, as I've said, modeling what healthy leadership looks like in public service, which, if you didn't know by now, listeners, you certainly better know after this episode, is not an easy task. But I'm so grateful that it's you who is up for that task and is doing such brilliant work of it at the Anne Arundel County Department of Health. So thank you so much.
Thank you so much for having me today, Shelly.
It was great spending time with you for another episode of Uncommon Minds. This episode was produced by Cheryl Tuesday, and it was written by Shelly Enriquez-Neal. We'll see you next time, and until then, stay true.
This podcast was edited by Resonate Recordings.